And we are back again. Gastrointestinal diseases are a group of diseases that occur in various parts of the digestive system. These diseases vary in severity, and the severity depending on their cause and type. Today we will discuss some of them with our guest, Dr. Ghanem Alsalem, consultant, internal medicine and gastroenterology. Hello and good morning, doctor.
Good morning to Kuwait, good morning to you, and good morning to our dear viewers. And thank you for hosting me on this wonderful show, which have a lot of people who follow this show, especially here in Kuwait. Our guests from abroad living in Kuwait, and for the Kuwaiti who are speaking English. This morning show, I like it because it has a lot of variety of things being showing. Test and show the Kuwaiti culture, as well as increase the awareness of what's happening worldwide.
Thank you so much for your kind words. You are welcome. We are glad to have you here, doctor, to talk about very important subjects, especially for this specialty, because medicine and the terminology there I cannot pronounce, so you will help me today. So as we approach the Hajj season, of course, we hear things like, because Hajj can host a lot of people from around the world, what can we do to be cautious and from vaccines, or tell us about what can we do?
Good. It's a good question, and as you know, we are approaching the season for Hajj, so we send our regards and best wishes for those who are going for Hajj, and we pray for Allah subhanahu wa ta'ala for acceptance for all those who are going for Hajj. As you mentioned, you're absolutely right that millions of people are staying in the same spot, moving the same way, same direction, and they do the same thing. So there are a lot of people gathering at the same time. And this can carry a lot of risk and hazards medical-wise to those who are in close community and communication. And you know, there's a small area, a lot of millions of people at the same spot. So you will expect some medical or illness may occur with these infections mainly. For that reason, we advise for the vaccines, and the authorities, the health authorities in Saudi Arabia, kindly they are sending these brochures and they are sending information about the vaccines. So they are encouraging people to take 3 main vaccines: the meningitis vaccine, the seasonal flu vaccine, and the pneumococcal, where the vaccine protects you from infection to the lungs. So these are the 3 major important vaccines we are advising all those who are going for Hajj this year, inshallah, to take them.
Yes.
And you can take them through the polyclinics in Kuwait, all around Kuwait. The other one is the COVID vaccine, where a lot of people ask me about the COVID vaccine. And the authorities, they mentioned it's optional, but we highly advising them to take the COVID vaccine. And also, especially for those who are above the age of 65, those who carry chronic diseases like lung disease, heart disease, liver disease, or kidney disease, they should take also the COVID vaccine to protect them. You know, this COVID pandemic, I hope it doesn't come back. It affected the humanity a lot.
Yes.
So for those, these are the main vaccines we are advising the Hajj people to take. And when you go to the polyclinic and take the vaccines, make sure you get the card stamped with the name of the vaccine, and also you can make a quick medical checkup with your doctor at the polyclinic to make sure that you're able and capable of doing the Hajj this year. Also today, Kuwait's actually sending these vaccines as official document to your program Sahel. So you can just have application, make sure that the vaccine is there, because they may ask you over there in Saudi Arabia to show the evidence of the vaccines, and you can show them through the application or through the card.
Yes, well said again, doctor, because these are very important information. Now to talk about preventive measures. Now, apart from vaccines, because in the Hajj season, everything can be, let's say, organized but hectic a little bit. So you can drink from the same cup with someone, stranger, you can be in a small place together, you can breathe the same air. What can we do in terms of wearing a mask, don't share your food, don't share your drink? Tell me about that.
Yeah, sure. Well, the major thing is, today I will advise those who are going for Hajj to keep themselves in a cold area, prevent to be exposed to the sun. You know, it's summertime, hot is very hot. Heat exhaustion or heat stroke is a risk for those, because as you know, in Arafah and during the Hajj, you'll be outside most of the time. So make sure that you have plenty of water to drink, and you're covering, or you have a shade to be under cover, so you don't get exposed directly to the sun and not to get heat exhausted. That's the most important one. The other thing is, as you mentioned, to you remember when during the COVID pandemic, we were advising people to wear the mask.
Yes.
That was a reason to prevent the infection or the spread of the viruses or the bacteria through the people. So that's, again, it's advisable to wear the mask, especially during where there's a crowd of people going on during the Hajj. So that's a very important one. I would highly encourage people to put the mask during the Hajj.
Yes.
The other thing is also make sure that you don't eat outside. You know that those who are going to the Hajj from Kuwait, they go to join the people together, and they all have the food, good source, and being highly clean. So make sure that you eat inside this area.
Yes.
Don't go outside and eat from street food or exposed food, because
Yes.
you may expose yourself to gastroenteritis,
Yes.
or it can really be very bad during that Hajj time. The other thing is also make sure that you don't touch your eye or ear or nose without cleaning your hand. So the hand is the main source for spreading infection or spreading diseases.
Yes.
So make sure always you have your hand clean with the sensitizers or with the soap. So you always make sure that the hand is very clean before you touch anything inside your body.
Yes.
And finally, always follow the instructions being given to the Ministry of Health, because the Ministry of Health are there,
Yes.
and they are providing information on daily basis to everybody in the Hajj, and everybody should be aware where is the health unit around them, near them. They are there all 24 hours to help you if you seek medical help.
Yes, I think that you mentioned everything that we need, and I really appreciate the information that you shared with the viewers. Now, since we have a limited time in this program, we would like to jump to another subject. Now, let's talk about the internal medicine. Now, the biggest organ,
Yes.
the liver.
Yes.
So now we hear about high and low enzymes inside the liver. First of all, tell us about what is high and low enzymes.
That's very good, important question about the largest organ, internal organ in the body is the liver, and the liver is very important to human.
Yes.
And nobody can live without a liver, so you always should have your liver healthy. So for the liver, we do a lot of tests to see where is the liver, if there is any problem or pathology with the liver. The main one would be the blood test. And in the blood test, we look at the liver function test, and we see how the liver is functioning, how the liver is doing the job it's supposed to do in a good way. So one of the measures, we measure the liver production of enzymes. They call the liver enzymes. And for those who have high liver enzymes, for example, you go for a regular checkup, or you want to go for a small surgery, and then they require you to do blood tests. Because the liver, at the early stages, if the liver is diseased or the pathology in the liver, they don't show symptoms or signs. It will be completely silent.
Yes.
So they will be found on the liver test, on the blood test. From there, we'll take it over, and we will see why you have liver enzymes high or raised up.
This is the only, I'm sorry, doctor, this is the only test to see if the enzymes high or low?
This is the initial test, the first one to be done first to check on the liver.
Yes.
Sometimes the liver enzymes, as you mentioned, low. Low mainly indicates good liver.
Yeah.
Sometimes patients may have malnutrition, or they have deficiency in some vitamins. They give low liver enzymes.
But it's better than high.
But yeah, of course.
Yeah.
High is a problem. High needs attention by the doctor, needs attention by the patient. So when you have liver enzymes high, then the doctor will start to take into a process of medical surface to look for the cause of this liver enzyme, why it's high. So we'll take medical history, detailed medical history, because it could be raised because of using medication, or if there is any family history of any disease or anything else, or the use of substance or alcohol or any other things can cause raised liver enzymes.
Or being obese.
Or being obese.
Yeah.
The other thing is then we will do for clinical examination, and look for your weight, your height, and your BMI, and look for any other causes of the liver enzymes raised. Then we will go into more details, looking into why the liver enzymes are high. That will include another blood test, detailed blood test, let's say, advanced blood test, and then some imaging, like ultrasound to start with, or probably we may need a CT scan or maybe MRI. Sometimes we use a fibroscan. This is a new technology where we look into the liver to see how the liver is elasticity, or how is it fibrous or tough, or is it smooth, to make sure what is the cause of the raised.
This is the advanced testing, because if you still have the problem, so you will go with that.
Yeah.
So now I have a very important question. Fatty livers comes from someone who is overweight or obese. Can you have a fatty liver without being overweight, or slightly overweight?
Yes, exactly.
Tell me about
That's a very good point. Sure. the most common cause of liver enzymes to be raised is a fatty liver. And the fatty liver is a very common disease. Now we see it in our community, our society. Yes. In the past, this is the information, in the past, liver transplant was due to a viral infection. That was the most common cause for liver transplant. Today, the most common cause of liver transplant is a liver failure from fatty liver. So fatty liver is really a dangerous disease or a dangerous sign that the liver may be exposed to damage. So we have to be careful, and we tell our dear viewers to make sure that you don't have a fatty liver. And if you do, you have to take early measurement to stop this fatty liver and make it good. Now, the fatty liver may come to the obese people, may come to thin people also. So fatty liver can be to anybody.
So now, okay, obese people, they eat a lot of fat. Maybe they are accumulated in the liver. So what about thin people?
Yes, it's not about eating fat. It's not about eating this. No, the liver itself is an organ where a lot of things going on in the liver. Okay, it's like a factory, let's say. Okay, so it has a lot of production, has a lot of processing, has a lot of biochemistry, chemical reactions. Some patients may have bad diet. They don't get obese, but they take high calorie, unnecessary, so they don't accumulate fat in the body. But the liver tries to overcome this bad dieting, let's say, and then they can cause triglycerides where it accumulates around the liver. So fatty liver is the fat accumulates around the tissue of the liver, and then the problem starts when the fats go infiltrate inside the liver cells, and then the liver cells become like foamy cells. They cannot do their job, and then you start to have hepatitis, or that's inflammation to the liver due to the fat, and then after that the process will go to fibrosis and may get cirrhosis or liver failure. So that's the main reason. It has most of the people, some patients may be diabetic. They have biochemistry or the chemical inside their body is not well established, and then they will develop the fatty liver. So the fatty liver not only for fat people, for a lot of people, for a lot of diseases, and sometimes maybe it's genetic cause, inherited by the families to have a fatty liver.
There is a new casual term, we share it here in society, especially in the United States. They call it skinny fat. The person who is skinny, but he's fatty. But he's skinny. Is it one of the things?
One of the things that you see skinny fatty. Patients or those people, they don't show the fats like you know them normally, where they have a large, let's say, body mass. But they do have the fat distribution inside their body is not
the abdominal and the liver.
Exactly. And then they will be exposed to a lot of things. These are at risk to have vascular disease also. They may have atherosclerosis, where the fat develop or accumulate in their vessels, and they are exposed to strokes or to the heart or to the brain. So that's a lot of things should be going on with them, and they really need a lot of attention by the doctor.
I drink a lot of coffee. Everybody knows that about me, my friends and my circle. And what is the coffee part in terms of liver disease?
That's a good news for the coffee drinkers. Coffee is good for the liver, okay? Coffee is good for your liver with a moderate amount. What we say by moderate amount is 1 cup, 2 cups per day. Black coffee, it's fine. But above that, it's not good because it has a lot of caffeine. And the caffeine, if it's in the moderate, in the good way, in the allowed
maybe some people can take it, actually, can take maybe more than 5.
Let me tell you something. People can do anything they want, okay? They can tolerate a lot of things. But we tell you what is good for your body, and then it's up to you to decide where to go.
But coffee is good for the liver?
Yes, coffee is 1 cup of coffee, I advise highly to the liver,
That's it, because we need what is good for the liver. We know now that coffee is good. We wish we have more time to talk about this very important subject. Thank you so much, Dr. Ghanem.
Thank you for having me, and I wish you all the health.
Thank you so much. Thank you. That was Dr. Ghanem Alsalem, consultant in internal medicine and gastroenterology. Now we will continue Good Morning Kuwait, but after this break, stay with us.